Hi, I'm Zishan Ahmed. Welcome to my YouTube channel Medical Core. Today we will discuss what is dengue fever, how it transmitted, what are the primary symptoms, and how we can diagnose in lab with a blood test. So first, what is dengue fever? Dengue can shortly called dengue virus, which belong to a family of flavivirus. It is encapsulated and single-stranded RNA virus. It have four genotypes, that is dengue virus 1, dengue virus 2, dengue virus 3 and dengue virus 4. Now, how dengue virus transmitted? So it's transmitted by female mosquito named Aedes aegypti. When infected person bited by Aedes aegypti and then it bite the healthy individual, so in this way the virus transmitted from the infected persons to healthy individual. When mosquito bites the infected individual, it takes virus from the persons. This virus then incubate in mosquito gut. This incubation is called intrinsic incubation because it happened in the mosquito, not in the person, and it takes 8 to 12 days. When this mosquito who got virus from the infected individual, when bites the healthy persons, it transfers the virus to healthy individual, then the virus incubate inside the persons and termed as intrinsic incubation, because this incubation take place inside the individual. It lasts for 3 to 14 days. Now, what are the primary symptoms of the dengue fever? These include high-grade fever, joint pain, muscle pain, rashes, nausea, and pain behind eye. Now, how can we diagnose dengue fever? The tests performed to diagnose dengue fever include non-structural protein 1, shortly NS1 protein, immunoglobulin M and immunoglobulin G, and real-time polymerase chain reactions, shortly RT-PCR. Now we will discuss NS1 protein. NS1 protein is a non-structured protein which performed on the strip method. It is a rapid test and it's positive in between 0 to 7 days of infection. Second test that usually recommended is immunoglobulin M and immunoglobulin G. IgM and IgG test is ELISA based serological test. It is detectable up to 12 days of the infection. Positive IgM means the infection is currently present, while the positive IgG shows past infections. Third, we will discuss the RT-PCR or real-time polymerase chain reaction test. It is a molecular test. It is more specific test than NS1 and IgM or IgG test. And we can determine the different genotypes of the dengue by doing this test. Real-time PCR is a confirmatory test. Other blood tests include complete blood count, in which we looking the red blood cells level, hemoglobin level and platelet level. Through this test, we can confirm is there any hemorrhagic events occurred or not in dengue patient. Thank you. Keep watching and tuning for more videos.